To escape from a problem, whether a burning building or a state of mind, a strategy is needed. Clear goal setting is vital when helping people in therapy. The emotional hijacking that happens during all psychological problems means that thinking strategically becomes more difficult. In a sense, the client needs to borrow the therapist's brain for a while until they too can think strategically and fully envisage a better future. The mind needs a clear orientation and a compelling blueprint fixed in the consciousness for how things can be better in the future. But if the client doesn't try to reach those goals or doesn't know where to begin, it all gets more difficult. You can help ensure your clients are clear about their goals, are motivated to make changes, and will take steps to achieve those goals. Even when a therapy goal seems obvious, it can be a good idea to check it with the client. For example, even if you're treating a spider phobia where you'd assume the goal was pretty self-evident, a little time spent clarifying the goal in positive terms can pay dividends. This is what happens when a client tries to frame a goal in negative terms.
So I'd like to ask you what it is that you really want from this session today. I mean, I know you've had a strong spider phobia, but can you just tell me in your own words what you'd like from this session ideally?
Well, I don't want to feel sick and terrified when I see a spider. I don't want to run away screaming. It's doing my head in.
Okay, so this is a sort of goal, but it's not really a strong blueprint for how the client wants things to be in the future. Imagine getting in a cab and telling the driver all the places you don't want to go. People who lead fearful lives tend to waste time focusing on what they don't want to have happen in the future, whereas successful, fulfilled people focus on positive possibilities and work towards them. Here, Mark pushes it a little further in order to begin to get a more positive goal.
So you don't want to run away screaming when you see a spider, of course. So how do you want to respond when you see a spider?
Well, like I said, I don't want to feel sick. I don't want to, avoid places spiders will be. I don't want to be scared of them. Okay,
so as we say, you don't want to respond in that way. But on the positive side, how do you want to respond when you see a spider? Ideally, if you can imagine seeing yourself respond when you see a spider, how would it be?
Okay, well, if I see one on TV, I won't change channel. If there's one in the room, I can, not panic and run away. I'd like to be able to calmly approach one and take it outside, because I don't want to hurt them.
No, absolutely right. You don't want to hurt them. And it'll be amazing to think, because you've had that phobia for so long, it'll be amazing to see your partner's face when she first sees you pick up a spider and put it outside. I mean, you can imagine what her face would be, the surprise or the,
Yeah.
And I'm serious, just right now, go inward a little bit and actually imagine her face when she first sees you dealing with a spider confidently and calmly. Just really get a sense of that right now in your imagination. And of course, you're not going to know for sure exactly how she's going to look when you're relaxed around spiders until the time comes.
You see here how Mark elicited a desired future in terms of what will be good rather than what wouldn't be bad. This can make a big difference to the course of therapy. Mark also began to build a little curiosity in his client by suggesting, but you're not going to know for sure how they'll look until that time comes. Curiosity is a powerful motivator. Other questions might be, what will be the first thing you'll notice? The very first thing that lets you know you've started to leave that depression behind. How will you seem or look different to other people, do you think, once you've started to feel so much more confident at work? And what's going to be the best thing about being free of smoking?